Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
This is RENAE Patterson. She is a nurse, but she also has an MBA, and she started an incredible company. She founded a company called Unified H.I.N.T.S, H-I-N-T-S, which stands for Health Information Notification and Tracking System. Tell us where you are now from the time that we were doing things together.
So I have really just been focusing on advertising to new customers and helping them understand the benefit of our company. Unified H.I.N.T.S is a patient advocacy company that's really powered by technology. And our goal is to help patients and their caregivers with consolidating all of their vital health information and important documents in one secure location. So we've really been on a mission to empower people to take control of their health. So from the last time we've interviewed up until now, it's really just been about educating consumers, patients, their caregivers on the importance of being proactive in managing their health care.
Well, and now of all times, don't you find it's just so critical? Little did you know that we were going to have this horrible virus, pandemic. Well, tell us your feeling about this. You've been in the healthcare field, and what are you doing to be safe, and what are you helping your family to do?
Well, I've been a registered nurse for 21 years, and I started as an ER nurse. So naturally, I have been encouraging everyone to shelter in place and to pretty much enforce those manners that we probably should have in place sometimes that people take for granted, such as good hand washing, not touching, their face often, covering their mouth when they sneeze or when they cough. So really just enforcing some of those regular manners that we sort of take for granted to assist in eliminating the spread. But the biggest component is really encouraging everyone to stay in place so we can help the healthcare workers help us and eliminate the spread of this virus so rapidly.
Yeah, it is really horrible down here. But, of course, you live in South Florida now, so it's, you're not, we have it down here, of course, but not in the huge catastrophe up there in New York, New Jersey, now California, Detroit. It's because people are not adhering to what they were told. That's what I think.
I believe that's true, and I've really, even now during this time, I've really been trying to send the message that we have to help our healthcare professionals, our first responders, our frontline workers to help us. And we can greatly help them two ways. One, by sheltering in place to eliminate the spread or minimize the spread of this virus. And two, if you find that you have to call rescue or go to an ER, you should go prepared. And when I say prepared, I mean know your symptoms, know when they started, have your medical history, your medications, your allergies, your surgeries, have all of that information readily available so when they are triaging you or assessing what your problem is, they can get to treating you faster than spending so much time on just collecting this pertinent data. So if you go ahead and you're prepared, have all this information readily available, the fire rescue, the ER doctors, the ER nurses can quickly get to providing you care and treatment and minimize the amount of time that they have to spend on just the data collection to understand what's wrong with you. So definitely sheltering in place and being prepared with that vital health information and your important documents.
Well, I'll tell you, the other day, my doctor called, and he has a nurse practitioner, and she's calling everyone, and she's wanting to have a talk on the phone. And they call it telemedicine, but for me, telemedicine would be viewing, that she can't really see me on the phone. She's just, right? And what you're doing, though, you have it where can't you see them?
So telehealth right now can work both ways. Ideally, you do want to have a computer or some type of mobile device available so you can see that provider that's talking to you and they can also see you as well. So ideally, you would like to have a computer or mobile device available. However, you do have a large population of people that may not have those devices available or don't have the knowledge on how to work their cameras or their microphones. So they're supplementing some of those conversations by just having a telephone conversation. So I think the providers are just really trying to reach the patients as best as they could using whatever technology they have available at the time.
I see. Yes, it's going to be a new world, and you actually invented a new world before it was necessary. Tell us again where this came into your mind. Here you're an RN. Of course, you did have a business. You have a business master's degree, but what really was the impetus for this?
Okay, so again, I've been a registered nurse for 21 years. I started my nursing career as an ER nurse at Jackson Memorial Hospital. It's a large county hospital, level 1 trauma center here in the Miami-Dade County area. And one of the things I encountered in that role in particular were people that came into the ER triage with complaints. The first thing we have to do is triage them. That's an assessment to understand why they're coming in. And we would routinely ask questions such as, why did you come in today? What's your medical history? What medications are you taking? What's your allergies? What's your surgeries? And a large number of times, the patient nor the caregivers were able to answer those questions. And I think sometimes as healthcare consumers, we minimize the importance of that information in the treatment plan that's developed for you when the doctor comes in and does his assessment and try to determine how to best treat you. So over time and time again, I saw how the patients and caregivers weren't really prepared during times of an emergency. Throughout my career, I've sort of worked in other areas such as home health nursing. I've done long-term care insurance assessments. I worked for ACO, which is the state regulatory agency. And in each of these roles, it required a large degree of interviewing patients and their caregivers and data collection. And one thing remained the same. People always struggle to recall vital health information. To complicate the struggle, their health information was often scattered between doctors' offices, hospitals, and their homes. And sometimes they just didn't have completed information. So this was a problem that was near and dear to my heart, and I developed a company to assist people with solving those problems. Our web application gives you a one-stop shop to store all of your vital health information and important documents. But in addition to our web application, we have a concierge service featuring PALs. PALs are your personal advocates and liaisons who work with you on a one-to-one basis to collect, organize, and manage all of your information in that one place.
You know, it is so important. I want to tell you that I know this is for people, but I have a dog who's been sick. And I have a file with all the things that he has had happen to him. He was someone I adopted. It's a hospice dog. He has congestive heart failure. But if I had something like you have, it's possible it would have been better because he went to one vet, then he went to another vet, and now when I go, I have to bring all the documentation, and I can understand. Now, that's a dog, but you're looking at people, and that's what people are having to do if they don't have what you that you've developed.
That's very true. We're trying to empower the healthcare consumer, the patient, the caregiver, families to just become organized with their health information. So when they're seeking treatment during those emergencies or while they're traveling, they can easily access this information from online. So that's the key there, making sure you have your vital information at your fingertips 24/7. So if you have an emergency, if you have a doctor's appointment, you're in a better position to relay the information that the doctors or the nurses need to treat you. You want to advocate for yourself that you get the best treatment possible, and a lot of that comes from the information that we know about ourselves and our health or our loved ones.
You know, Renee, this really is it's really a wonderful thing that you came up with this, and I know you've been struggling with it because you're like a frontier. You're trying to educate people, and they weren't ready for this, but I think now with this virus, they get it. I think they're ready, and it's not something that you wanted to see. It happened because of it, but don't you feel it's been better now because of it?
I truly believe people see healthcare in a different light. Some of the challenges that they're viewing now on television that's taking place in some of the healthcare systems or some challenges that probably were present before now, but now they're seeing it firsthand, what it takes to take care of sick people. I think people that are generally healthy now feel a little bit more vulnerable to this virus. So now they're viewing their health in a different view as well. So I think overall people are now understanding what the importance of maintaining your health is about, what the importance of being proactive, because right now we're being proactive in not trying to acquire this virus. So
Yes.
I think everyone in totality is now viewing their health and how the healthcare system operates in a different light. So definitely, and I just want to encourage people that, while we're sheltering in place and while we have this virus here, take the time to prepare yourself and become organized in the event an emergency does take place. The last thing you want to do is be scrambling around to recall your medication names, what your allergies are, what your medical history is. Come to your doctor's appointments or go to the emergency room, or when you call fire rescue, be prepared so they can better treat you. Help them to be able to quickly assess or determine if this is the coronavirus versus a regular flu, or maybe something related to another chronic illness that you have. And the only way that's going to happen is if we do our part in being prepared.
And will this be something that would be on your iPhone? I mean, if you're going to the hospital and you have all this information, is that how they will access it?
Yes, this is a web application. So as long as you have internet access, you can access this application. You would log onto your account. As soon as you log into your account, there's a dashboard readily available, and that dashboard gives you a quick snapshot of your emergency contact information, your medications, your allergies, and your provider's names. So you can have that information readily available to even show it to a paramedic or show it to an ER nurse or show it to an ER doctor. So if you're not feeling that well, they have something to look at or something to go off of if you aren't able to verbally tell them this information. And again, we have to think about our family members. Some of us aren't as fortunate to live nearby or in the same cities or states. So in the event of an emergency, if you are listed as an emergency contact for a loved one, you should be able to also provide this information to healthcare providers. So our family accounts allow you to do exactly that. You are able to have one account where you see all of the health information for your loved one. So if you are called upon to assess, to help out in an emergency, you're empowered to do so.
And so when this person, the person who's your client, then they can send everything to their loved ones just when they develop this. They don't have to wait for an illness.
No, they don't have to wait. When they create their account initially, once they enter all of their pertinent information, it generates a patient health summary report, and they have the ability to email that report to family members or to their provider, and the report is password protected, but they are able to share this document so someone other than themselves have a synopsis of what's going on with their health care. And I know some people are probably thinking, oh, I could never do that. That's why you have your PALs, you have your personal advocates and liaisons, where we work with you one-to-one to make sure we get you organized. We help you with collecting, organizing, and managing all your information in that one place. So you can rely on us to help you get through some of those technical challenges that you may be afraid of.
RENAE, you are so smart. I mean, it is such a pleasure to have you do. It is amazing, absolutely amazing. So I just want to say that you're certainly you've invented something that I think has great merit, and I'm really hoping that everything turns out for you doing that, because it certainly is Are you there?
Yes, I'm here.
So I'm thinking, would you tell people the price now? I think they would like to know, is this very expensive?
It's not very expensive. So we offer 4 subscription tiers currently. We have a Silver and a Silver Plus plan, and the Silver and Silver Plus plans are designed for individuals and family members who are a little bit more tech savvy and they're capable of managing their own accounts. And those plans are $1.99 per month, and $3.99 per month. And then we have our Gold and our Gold Plus plans. And those plans are for individuals and family members who subscribe to our PALS concierge service. And those plans there are priced at $9.99 a month and $19.99 a month. And again, our pricing is affordable because our true mission is to empower people to take control of their health.
Yeah, it is. I've always been surprised that it was so inexpensive. That's why I wanted you to talk about it. Because, it's, but you know, you've done this. It was an invention, and you did this yourself, didn't you? I mean, this was your idea.
Yes, I am the founder and CEO of the company. I have built this company from ground up. I have built the actual web application from ground up, and I've solely used all of my funds to do so. It's something that I'm definitely passionate about just by having started this business and investing all of my money to bring it to light so I can help other people. And during this time, you know, money really isn't as important as making sure people are prepared and they're empowered to advocate for themselves during a time like this. So if there's anyone out there that's listening that just needs some help, some support, you know, some guidance or some additional information on resources, we are here for you. We are available. Don't worry about cost, price, or anything. We just want to make sure we get through this together as a nation, but most importantly, our seniors who are, you know, especially vulnerable just by having probably weaker immune systems. We just want to see everyone get through this healthy and safely. So if there's any questions, any concerns, you can feel free to reach out to us. No charge, no cost. We just want to help.
And I want to now give everyone the phone number. So everybody remember, this is Pencil Talk Radio. So you're going to call 833-694-4687. Is that correct?
Yes. It's
okay, let me do it again. 833-694-4687. It may be easier for you to remember their website, which is UnifiedHints.com. Unified Hints, HINTS.com. And why don't you explain what HINTS stands for?
HINTS stands for Health Information Notification and Tracking System. So it's pretty much a little self-explanatory. Our thought process is to give you one place that you can go constantly for all of your health information and important documents, hence the name Unified Hints. All of your information is unified in one place, and if you're struggling to remember it or find it, your hint is right here within our web application, Unified Hints. So that's how the name came about. And I think I probably didn't mention earlier, in addition to health information, we do have unlimited storage for important documents such as your advance directives, living will, power of attorney, healthcare surrogate. So if you need a place to store that information as well, our website allows you to do so. If you have not taken the time to complete any of those documents, any of your estate planning documents, we encourage you to do so also. Now is the time to make sure you have all those documents taken care of, updated, and your family knows how to access them in the event of an emergency.
And while you were talking, I know you don't do it. And can we put passwords on there? Oh, the password system is horrible.
Yeah.
I'm kidding. But it's, because what you've done is you figured out how people can have everything. Because, you know, someone will say in a medical office, do you have your documents ready? I mean, you know, do you have a care advocate and all? And you say yes, but you don't even know, and if they need it, they don't ask you, but you'd have it there.
Yes, exactly. That's the goal. If you were in a doctor's appointment, had an emergency, and they wanted to see perhaps your HIPAA authorization on who you would allow to share your health information with, you can have a copy readily available. If someone needs the copy, you can download it from your device or from your account and send that copy to them. So that's the goal, just to make sure we're prepared at all times to know where our information is and to know our information. This is really about empowering the healthcare consumer. I think a lot of times we just rely on the healthcare organization or the doctor's office having our information, but it's up to us to make sure even the information they have is up to date and accurate. So we're really just trying to give the healthcare consumer a tool to stay organized, informed, and empowered.
Yep, that's what you do. You do it very well. In the time we have left, can you share with us, and not anybody's name, but share with us a couple of the people and kind of who they are and what they've done, and have they used it? I think people would be interested in that.
Yeah, definitely. Since we've had some time at home, I've spent a lot of time even with my immediate family members where we were on go-to meetings or virtual meetings where I'm like, let's sit down, go through your Unified H.I.N.T.S account, make sure all your information is updated and accurate. So I've definitely spent a lot of time doing that with either my mom, my aunts, and my cousins. And then some of my customers that have chronic illnesses, calling them, touching base with them, making sure they're okay, making sure they know how to access their information, making sure their accounts are accurate as well. So I have customers that have chronic illnesses. I have customers that have disabilities where they can't see. So it's just really making sure the customers that I currently have know their account names, know their passwords are updated, knowing that their account information is updated, knowing that we're here ready and willing to assist them in the event of an emergency, but also trying to bring awareness to potential customers that our company exists and making them aware of the types of products and services we have available to them during this time.
Yeah, that must have been fun doing this with your family, because they probably didn't really know what you do. You know, you started this, and most of the time our family doesn't know what we do, and they must have really gotten into it. Do you also put on supplements and vitamins?
There's a medication section, so you do have the ability to list your supplements and vitamins as a medication that's listed over the counter, and you can enter a reason for why you're taking that medication. So, yes, they are included.
Yeah, I think that's important, because sometimes the supplements are really, they don't work well with the medications.
That's true, and that's why it's important that when we go to a doctor's appointment, beyond this pandemic that we experience, even when we go to our regular doctor's appointments or to see a specialist, it's important that we remember all the medications that we're taking so they can develop the best treatment plan possible moving forward, because it's the little things that we think that don't matter that can make a difference in the treatment plan that's developed for you and your overall outcome and your health.
You know, it's true, and you're going to laugh at this, but when I went to a new doctor, I took all my supplements and a couple of the prescriptions I've taken in a bag and dropped it on and dropped it. But if I had what you did, I would just have to open that and show it to them, right?
Yeah, you can open the application and show them the list of your medication. If you have a printer at home or the resources at home, you can always print out your patient health summary prior to doctor's appointments. Keep a hard copy on the refrigerator or wherever you designate that hard copy, so you always have a list of those items readily available for you. Definitely.
Wow. Well, it's quite an invention, and I'm sure that there are investors out there who would love to work with you. It's like, and I don't know if that's what you're looking for. I know that it's been hard for you, because it's any new business, especially a frontier kind of business, one that you have to educate everyone. It's not easy, but you're marvelous that you've just stuck with this because you believe in it so much, don't you?
Yeah, I do. So currently I'm not looking for investors. What I am looking for are other businesses that share similar visions, if you will, who does maybe a similar line of work where we could develop strategic partnerships and business relationships. So if there's anyone out there that's listening, maybe a home health agency, assisted living facility, any caregiver organizations, charitable organizations, if your mission is to empower people to take control of their health so they can live longer, healthier lives, then I definitely would like to hear from you to see if there are any synergies or partnerships available that we can develop to work together, because it really will take, a village, if you will, for us to deliver this message and to educate consumers on the importance of being proactive in their health care. They are the nucleus in ensuring that they get the best health care possible. And I encourage everyone to advocate for themselves. Ask all the hard questions, the difficult questions. Go to your doctor's appointments prepared with your questions. Take a family member with you if you have one available who can also help advocate for you. Now's the time.
Yes, really what you are. You're a system, of course, a health system, but you do talk a lot about advocating. And that's, I've always believed in that. In my capacity as a gerontologist, I always say, if you go to the hospital, you go to a doctor, you need to have someone with you. You need to have an advocate. And your system is almost an advocate in a sense,
It's exactly that. I usually, when people say what's Unified H.I.N.T.S, I usually reply with, we're patient advocacy powered by technology. Yes, we have a web application. Yes, the technology's there, but it's our patient advocacy that makes us unique and makes us different from other companies. It's our human touch, our concierge service that work with you to make sure you are empowered to receive better health care.
Absolutely. You really are. It's that's something that I know I've talked to you about that before, but I love advocates, and that's what you do.
And I think probably you asked me what was new also since the last time I talked to you. I did receive my board certification in patient advocacy too recently.
Oh, I didn't know something like that.
Yeah, I am a board certified patient advocate now. I've got some certifications since the last time we spoke.
That's wonderful. Well, it's been so good to talk to you again. I know I've missed you. I've been curious about what's been happening, and I'm so glad that we got you on the radio again. Let me give everyone your phone number to call. It's 833-694-4687, or go to their website, which is unifiedhints.com. Thank you, and stay safe, Renee.
Thank you, and you do likewise.
Okay. Yes. All right. Bye.